So I am so excited about our next speaker because this is actually my favorite topic and one I wanted to hear about, because I feel like nutrition is the one thing we can do for ourselves. We don't have a cure. We don't have any real therapies that have been clinically proven to work. But what we put into our body, I feel like, can help us. And so I thank you so much for coming. And I think I know there's a number of people here who are trying different diets. And so I would really encourage you, please ask questions, because I want to hear your experience too with these diets, because we have not really followed any truly specific diet yet, but I've heard they can help. So please, share your knowledge.
That's okay. Hi, everybody. I'm Liz Enagonio, and I'm one of the dietitians here at Kennedy Krieger. I have the great honor of working with Dr. Fatimi with several of his groups of patients, and I just want to thank you, Dr. Fatimi, for inviting me to speak, and Beth, thank you for your lovely introduction. Thanks to all of you family members and patients who are here, and to all of you citizen advocates for your own family members and your children. We can't do it without you. We cannot do anything without you. So thank you for that. I'm going to try to keep this kind of short and a quick overview, because I want to leave some time for people to ask questions. As well, I'm happy to hang out afterwards for a little bit if people want to talk to me too. So we don't really have good specific nutrition answers. So the way I'm going to handle this is I'm going to talk about some general principles for nutrition health that meet all of our needs to be well nourished, whether or not we have LBSL or anything else. And as well, I'm going to talk about some common nutrition concerns that come up for individuals with any kind of neurological changes going on. So I listed a bunch of them there, and I'll talk about each of them as we go through that. As well, I'm going to talk about what I'm calling supportive nutrition approaches. So some of these, as Beth correctly said, may not be proven to do anything to ameliorate symptoms, but if it works for you, for your child, these are not things that will harm you, with a few caveats. We're going to talk about a few caveats, but above all, do no harm. So just some quick general nutrition principles which apply to all of us. We want to get adequate but not excess calories. We want to get the macronutrients, which are protein, carbohydrate, and fat. We want vitamins and minerals that are enough but not too much. And a key thing for many of us, whether or not we have any kind of condition, or that we feel like we're perfectly healthy or whatever, wherever we are, fluid is huge. And I see lots of children with any imaginable diagnosis who don't get enough fluid in, and it's a challenge for the caregivers. It wants to be a balanced diet. So we talk about food groups, and USDA has put out a sort of new kind of guidance here within the last several years that's a little more user-friendly. We used to have the pyramid. Before that, I'm old enough to remember the square and the 4 food groups and all this stuff. Right now, we're using the model of a plate and proportionality of the different food groups: fruits, vegetables, grains, and protein, and dairy, or in many cases, our kiddos don't necessarily. Yes, ma'am.
I just wanted to let everyone know that some of the grocery stores actually sell those paper plates.
Absolutely, yeah. What a great idea. And I have, I have a teaching plate that's this, so thank you for that you all could go out and do this too. I wanted to say about dairy, of course, what do we want from dairy? We want calcium and we want vitamin D. It's got other good nutrition like proteins. But many of our kiddos or ourselves may not tolerate a lot of dairy. And so many of the substitutions, such as soy milk, almond milk, can play a role in that, and most of the really well-known brands are fortified to be equal to dairy milk. So that's a good option if your child or yourself, you don't tolerate dairy. With someone who has a neurological condition, particularly one that changes over time, we look at a couple of things. One thing is that some individuals may have higher calorie needs. A good example of that is someone who has, as part of their neurological picture, extraneous movements, burns a lot of calories, hard to get the weight on the person. There are other reasons for difficulty gaining weight, and I'm going to touch on some of them. So we have tons of strategies. We want to do the least invasive thing first. So we might use calorie supplements. We might use food-based, higher calorie foods. We might have frequent small meals, avoiding fasting, and if we need to, we'll go to enteral or tube feeding. And in very rare cases, and this would be if there were some, usually it's a GI or a safety or a combination of things where we have to have IV nutrition, but that's rare. Metabolic dysregulation. So within the big, and I'm talking, so I'm going to cover LBSL, but I'm also going to look at sort of the leukoencephalopathies and leukodystrophies, because they're all different aspects of neurological and white matter disease. Some of those include a metabolic pathway that's not working. So, for example, when I see my patients with X-linked adrenoleukodystrophy, they don't metabolize a certain kind of long-chain fatty acids. So we can't give that to them because it builds up in their body and causes damage to the tissues. Well, so that means that that person already has a special diet, and that can be very challenging. Strangely enough, and I'll look at my XALD patients as an example of this, so they're restricted from eating fat. They have a very low-fat diet. They have an extremely low saturated fat diet. What do you think they do? They eat sugar, sweets, treats, crunchies. They have a feeling of insatiety because they don't get fat in their diet. They get bored with their diet, and they eat a lot of sugar. And now I'm struggling with a lot of my teenagers who are overweight. So it's, every patient is individual, every child, every adult. You could go either way. Our goal is to keep you down the middle. Some of the other concerns that can happen with neurological change or difference, or especially if it's something where your neurology, you're having some degeneration over time, is oral motor difficulty. So trouble chewing, trouble keeping a bolus of food, trouble swallowing, all of those things, fatiguing after eating a small amount of food. I follow several adult patients who have Palazius-Merzbacher. They are, over time, it gets harder and harder for them to chew, to swallow, to process the food, and to be safe. So again, we always want to start with the least intervention possible and move forward only as we need to. Changing the texture of foods, softer foods, foods that are easier to manage, foods that are high in calorie in a small volume. I always think of, your mac and cheeses and your full-fat yogurt and all the things that, we try to stay away from, but we're trying to make them nutritionally sound too. So I'm not going to say go eat 20 candy bars. I'm also not going to say never eat a candy bar though. Small frequent meals, high calorie liquid supplements, you guys probably know, your such as a Pediasure and Sure Boost, those kind of things. Over time, if the neurological impairment is especially affecting safety of swallowing, that's when the person may need a feeding tube, a gastrostomy tube, because it's just not safe for them to be taking in solids and or liquids because it into their lung. So I've kind of covered the second thing about swallowing safety with either choking or aspiration. A swallow study is one of the more common ways of assessing whether things are going into the lungs instead of down the esophagus. There are other studies that ENT can do called a FAQs, where they look through all the cavity and down, and those are also very effective. Again, first thing we want to do, modify the consistency to make it easier and safer. Stay away from those risky choking foods. Anybody who's had a little kid or a toddler, hot dogs, not the round thing. That's the perfect size of the esophagus. Cutting up hot dogs, not giving hard things like nuts that are very hard to chew and are dangerous in the throat. Sometimes after a swallow study, a person may be asked to limit what they take in, either for safety reasons because they fatigue later in the meal and are more at risk, or because they do fatigue so much that the effort of eating burns more calories than they can take in. Sometimes they can do solids but not drinks because drinks are slippery and they get in the lungs. So a speech language pathologist or an occupational therapist who is skilled in oral motor skills can help assess this. As well, some of our kiddos or ourselves may benefit from some oral motor therapy to strengthen that, to learn compensation. If you think about a person who's had perhaps a stroke, which is another neurological event that's happened, sometimes we can do positioning, we can do a chin tuck. That's true for anybody that has neurological swallowing difficulty. It can help. GI dysfunction. If we have a mitochondrial disorder, that can impair your GI function as it can impair other parts of your body, because the nerves are telling the GI tract how to react. They're sensing when your stomach's full. They're telling the gut to move and move the food along. When we have that, we can have symptoms such as gastroesophageal reflux. We can have that anyway. And that could be shown as pain or throat discomfort, food coming back up, or even vomiting. Again, we always start with the lightest strategy, the least invasive. Positioning, medications such as Prevacid, avoiding foods that may make you reflux more. Also, slow motility elsewhere in the gut. So at the top part with the esophagus and the stomach, we call that esophageal and gastric dysmotility, failure to do the peristalsis that moves the food along. Food feels like it gets stuck. It literally does sometimes. You feel full after a small volume food. You may have vomiting. There are some strategies for that, and I listed them here. Small, frequent meals, using liquids to get some of your calories, eating and drinking together, modifying texture, and there are medications that help improve motility for some people. That would be a gastroenterologist who would look at that. I know constipation is a ginormous concern for anybody that has neurological difference. Why not? It's not moving either. So we have several strategies. We always want to look at the simplest thing. That's my theme today. Are we all getting enough fluid? Because we need that water to be in the colon so the stool stays soft and easy to pass. Are we getting enough fiber? Fiber comes in two kinds. One of them, the insoluble fiber, helps add bulk and keep the water in the stool to make it stay soft and easy to pass. Some kids won't do it. Sometimes there's another piece. It's hard for me to manage my liquid, so I'm not drinking because I feel like I'm going to choke. So it's a complicated question. It may require several specialists to work with the individual. So first, we're going to look to make sure, try to get adequate fluid in, encourage drinking, try to get in adequate dietary fiber, especially for constipation. We're looking at insoluble fiber, and exercise or movement to the capability that your physiology allows, because as we improve the muscle tone everywhere, it has beneficial effects on muscle tone throughout the body, with the caveat that if the nervous system isn't sending the right signals, then this isn't going to solve it, because the muscular piece is sort of a different component. Also, you may require medication, because either if your tone is low in the gut or you have poor motility, all your strategies in the world aren't going to change that. And so in that case, we may need to have medication to manage the tone. We need those prokinetic agents, which are the medications that help your motility. We may need to use stool softeners like a Miralax. Sometimes we have to go on to a more harsh, I guess would be a word, such as a true laxative, using suppositories, enemas, and even sometimes having to have a really structured bowel program. Picky eating. Oh my goodness. So I work in the feeding disorders program, so this is my baby. We see it across all kinds of diagnoses and across children who have no diagnoses other than being 5 years old. But it's a problem. And we do have programs to help with that. When I'm looking at somebody, so I'm thinking about some of my patients with, the very different leukoencephalopathies, they may have picky eating on top of a diet that's restricted. So that's where it becomes very challenging because, I think about my boys, they're not going to be able to have those fat, they're on a very low fat diet, they're on a low saturated fat diet. They want to eat all this sugar and sweet stuff like that. That's not a good diet. And yet I can't let them have just anything they want. So it's challenging for caregivers. It's challenging for the patients themselves to be on those limited diets. I'm going to talk very briefly about the ketogenic diet later on, but that's probably the most challenging of all. Dietary noncompliance, refusal to eat the diet recommended. So we do have some things. We do behavioral feeding therapy here, food chaining where you start with something they like and try to bring it in similar foods, and creative presentation of foods can really help some people. Specialized diets are very hard to follow. If you think about us as adults, if we have type 2 diabetes and we have to limit our carbohydrates, we have to eat adequate protein, we have to do this, we have to do that, that's very hard for us to comply with. If you're thinking about a child with a very specialized diet, and you're trying to explain to them why they have to do it, it's hard. It might be unappetizing. Some of them can create other health risks. It further limits the picky eaters. It's difficult to maintain compliance, and it could be extra cost or preparation for the caregivers. The ketogenic diet, I know, Beth, you had mentioned that some people have asked about that. I can talk in more detail about it later. The biggest clinical use of the ketogenic diet is to manage seizures that aren't responding to medications. The ketogenic diet is very restrictive, it's very unpleasant, and it requires medical supervision to start and to manage and frequent follow-up. So don't try it at home. I actually had a family come to feeding clinic. They had tried to put their child on it, didn't have seizures. Not sure why they did. That kid literally went into hypovolemic shock and was in the hospital for a month. It was pretty scary. So don't do this at home. Pharmacological treatment, I'm thinking about your mitochondrial cocktail. That is really the realm of the neurologist to work on that. The goal of that is to either replace or enhance the enzymes or cofactors that aren't produced or modified correctly or used correctly in your body to make energy. And we want to replace or increase those compounds that help in that metabolic chain for turning food into energy. Some of those in the mitochondria cocktail are disease specific, or their efficacy isn't really clear yet for a number of reasons. That's why we're doing research. But as well, since the many leukodystrophies and leukoencephalopathies are from so many different gene differences, it's hard to get a big sample of any one thing. So these are a good example of they help people. We know they help people. We might know why they help people. They may help some and not others, but at least they aren't going to hurt you. Again, thanks to Beth for this. She mentioned a few things that people have tried. So antioxidant-rich diets, a lot of fruits and vegetables, great, we should all do it. Antioxidant supplements, a little more caution. The goal is for antioxidants is to reduce oxygen. That oxygen's a double-edged sword. We need it to live, but when it gets into those free radicals, it damages our tissues. So we, by taking an antioxidant, can bond up those molecules and prevent them from harming the tissues. Trouble is, there is too much of a good thing. So, you don't want to randomly take huge amounts of antioxidant supplements. That's something you might want to get a little guidance on. Healthy eating plans, I advocate many of these. The DASH diet, dietary approaches to stop hypertension. It's very similar to the Mediterranean diet in that it emphasizes simple foods, lean proteins, non-animal proteins, fruits, vegetables, olive oil, because it's got a lot of unsaturated fat, the more healthful kind, avoiding processed foods, so it's a good healthy eating plan anyway for any of us. The goal of any of these diets for all of us, including those with any of the leukodystrophies or leukoencephalopathies, and those of us who don't, is that we want to have optimal health for our patients, our family members, our children. We want them to have the best fighting chance to be as healthy as possible. And as Beth says, we can control the food. Sometimes we try. We want to manage those symptoms and avoid secondary mitochondrial dysregulation, meaning that if we're not eating right, we are perhaps not getting in those factors that we need, like the vitamins and minerals, in a sufficient amount for a healthy person, let alone somebody who has already a mitochondrial disease. So here are some of your frequently asked questions, I think. I'm going to whip through them and then let you ask more specific questions. So I'm that dietitian. There are no bad foods. There's just proportionality. So avoiding foods, if they hurt you, if they make you have reflux, if you're allergic to them, if they make you vomit, if they give you a headache, you avoid them. Should certain foods be emphasized? I would say that the ultimate goal here is the most healthy, clean, if you will, diet with the most, go to the grocery store, shop around the outside, cook it simply, stay out of the middle if you can, because that's where all the processed stuff is. That's good for all of us. It's good for our family members who have either LBSL or another one of these disorders, but it's good for us too. They can bring us to eating better. Eating organic foods and health. So that's a tricky one because there are pesticides on food that in the laboratory can cause cancer. Do they cause cancer for people when we eat those foods as part of a mixed diet? The evidence is a little less clear, yet many people prefer to stay away from that, and that's very understandable. As well, going organic is good for our land, it's good for our food supply, it's good for our farm workers not to be exposed to that. The sort of counterbalance to that is that not everything's available and some of it can be very expensive. So you guys might be aware they always, every year, they put out a list of the Dirty Dozen, the top 12 foods that have the most pesticides, the most quantity, the most variety when tested in a lab. And a lot of the advice is, if you're going to do anything organic, do these. Who's the winner this year? It's the same as every year. Strawberries, one of my favorite, but they really require a lot of treatment in the field. Spinach, that's another one. Some of these things can be washed off, some permeate the cells and tissues of the food. So I leave that to you. It's certainly not a bad thing. Should sugar be avoided? If so, how stringently? So when we think about sugar, we're thinking about white sugar, which is actually brown sugar is white sugar, maple syrup is sugar, honey is sugar. They're all the same, simple sucrose. What the problem is when it's added to foods, it adds calories that have little to no nutrition value. So we don't need it. We want to focus on our whole foods, our more healthful foods, our foods that have natural sugars, such as dairy foods, such as fruits, some of the vegetables, certain starches. So how stringently? It's kind of up to each of us. The more we eat sort of home prepared or lightly prepared foods, the less added sugar we're going to have. If one of us or our child needs a formula such as Pediasure, it's going to be full of sugar. Why is it full of sugar? Because what substance gives us our ability, our energy? Glucose. Glucose is half a sugar molecule. It's broken down in our body. All sugars, all carbohydrates are broken down and transformed to glucose. That's obligate for the brain. We have to have it for the brain to run on. In a Pediasure, it's all sugar because I can't put a piece of bread in there. So a lot of parents don't like it, but it's sort of one of those, yeah, but they're getting all the nutrition they need that way. and that's how it is. So it's, there's some alternatives, but it's hard. Pros and cons of probiotics. They are very clearly indicated, they have been demonstrated, certain strains, that when you have gut bacteria dysregulation, usually from taking a broad spectrum antibiotic, the probiotic comes in. It is a beneficial kind of bacteria. It not only repopulates the colon with itself, but sets up a milieu, a room that's comfortable to the good bacteria. So it is very successful at treating diarrhea, especially diarrhea that's induced by antibiotics. Is it good for anything else? Maybe. We don't always know. It won't hurt you. A lot of people put their children on it and say it helps also with constipation. I don't know the science to that. I don't think anybody does, but if it works, do it. So I've covered a few things. I'd like to open it up to questions, comments, and as I said, I'll be happy to stay back after the conference and talk to people, if you have some specific questions.